Hi, everyone. My name is Maiko. I'm from Nexus Motion. It's another fun conversation time with one of the leading physical therapists. Today, my guest is Dr. Marcie Harris-Hayes from Washington University in St. Louis. Marcie, thanks so much for joining me.
Hi, Maiko. Thank you so much for having me. I'm really looking forward to this.
All right. And I have to point out that you're wearing an awesome polo shirt today. And that was from our good times back in Hawaii and Honolulu when we got to do an event. So my goal today is to showcase what my guests do in their career as a physical therapist and hopefully get a little glimpse of the journey and how they got to be where they are now. So before I get started with some of my questions, if you could please tell the audience about what your current roles are at Washington University.
Sure. So currently I am professor in the program of physical therapy and orthopedic surgery at Washington University. And my role is a combination of research, administration, and education. Of course, the most exciting is research and education. And it really, depending on the funding, that percentage can vary, but I'm about 35 education, 65 research.
Very good. And originally, back to kind of where it all started, how did you decide to become a physical therapist in the first place?
Well, I think I just got really, really lucky. Coming out of school, I wasn't or kind of going through school, I wasn't really certain what I wanted to do. I thought I wanted to be a basketball coach. I thought I wanted to be a surgeon who repaired ACLs. I didn't want to do anything else, just repair ACLs. And then as I had a couple of friends who were interested in physical therapy, and they kind of introduced me to it. And then, of course, from there, I did some volunteering, observations, just to see kind of what it was all about. And I really, it really struck me was the ability to help people move better. And most of my experience was actually in more of an acute or a rehab setting, seeing people with some significant mobility deficits. And I think that really kind of motivated me to go to school and get the degree.
Nice. Now, you mentioned basketball. You were a basketball player. Did you play through high school and college, and any injuries that you experienced?
Yeah. So if you met me in standing, that's the first question you would ask. So I'm 6 foot tall. And so I played center in high school, and then I played a couple of years in community college, which is a 2-year college in the US. And did fairly well. I was really pretty fortunate as far as injuries. I had chronic ankle sprains, so it was very common for me to have a sprain, but I never had any like an ACL injury, any serious injury that I had to refrain from sports for a long period of time. So as frustrating as it was to sprain an ankle, big picture, I stayed pretty healthy, so that's good.
Now, you already had some spark of interest in ACL. Were you exposed to ACL injuries, your teammates or somebody you knew?
Yeah, so we had, I think, when I was playing not during high school, but in college, I think we had 3 women on our team that had ACL tears at different phases. And so that's probably the only reason why I even knew about them or were interested in it.
Now, you got your education at Northwestern University, another great school, and then you eventually became faculty at Washington University. Was it always your intention to become a teacher or become a researcher?
So the true answer to that would be no. Just to be honest, I don't think I ever, coming out of PT school, I don't think I felt like I would be qualified to get into a faculty position or into a researcher position. I come from a family where I'm the first to go to college, so we didn't really understand high level education. That was something that other people did. So I really didn't It wasn't a goal that I had set for myself. But fortunately, the clinic that I worked in coming out of PT school was closely related to the Washington University faculty. And I got to be exposed to them, have conversations with them, learn about what they were doing. And that led to some lab assisting. Interestingly, my first lab assisting was in how to treat burns and wheelchair mobility. Completely different than what my job is right now. But then the relationships kind of grew from there, and I began to gain more confidence in my ability to work with students. And then I became interested, and then I started to pursue that opportunity.
I see. So there's been this like step by step, but it's always about that connection, who you end up meeting at your workplace, and just starting those additional talks outside of the clinic hours, probably.
Yeah, absolutely. Absolutely.
Now, what do you most enjoy about teaching the DPT students?
It is just the students themselves. I'll admit the scary part is I think students are just getting smarter and smarter and smarter. And so the fun of that is being challenged. You've been teaching something for a number of years, and then someone will ask that question, well, why? And then it really makes you kind of step back and go, oh, let me rethink about that. So it's really an opportunity to help keep the thinking process fresh. And then, of course, just, the energy of youth, which as older as I get, it seems like energy is less and less available. But they can definitely be energizing as well. So being able to be immersed in that energy and then in that, challenging environment is really just kind of keeps one ticking, if you will.
Definitely, it keeps us on our toes when we're explaining something, and then that gets questioned. It's a good thing. It's a good thing.
Absolutely, absolutely.
Now, when I was a DPT student, you were teaching us a lot about the knee joint. Did you get bored with the knee and just kind of made your way up to be the hip person?
Yeah, it's a great question, Maiko. There's probably a couple of different things that contributed to that. So I'll try to keep it short. I started teaching in the knee, loved the knee, did a lot of, work in helping with that. And then I started to get interested in research, and I had an opportunity to do some research in low back pain in Linda Van Dillen's lab. And the more I learned about both of them, I realized that really the hip is the problem, right? The hip affects the spine and the hip affects the knee. So we should just go right to the middleman and focus on the hip. And the second reason is it really is an open field. As far as rehab is concerned, there's a lot of investigators that are studying patellofemoral pain, ACL injuries, and there's a lot of therapists that are studying low back pain. There's not as many of us studying hip pain. That's growing. We have a growing group that's studying it. So it's a little bit more of an open field where it comes to research. So probably both of those things combined kind of moved me into that region.
Yes, I definitely agree. The longer we stay out in the clinic, seeing different kinds of patients, we just keep over and over. The hip is the key in making your back better, making your knee better. So yes, that is the key.
So I'm speaking to the choir then.
I think it's a little bit more complicated than the knee joint also, so that's probably more exciting to think about all these different planes of movement that the hip has to go through.
That's very true. I would agree with you, Maiko. I do think the hip is more complicated, and that's probably why there aren't as many people studying it. It is a bit more challenging.
Mm-hmm. Now, in your research projects, I think you work closely with not just with other PTs, but with surgeons and radiologists. How do you think WashU is so successful in creating such a collaborative culture? Do you think it's the personality of the PI, or are the surgeons just super nice at WashU?
Yeah, so it's probably a bit of both, I would say. I do think that there's been an evolution in orthopedic surgery where before it was all about the surgery. And then over time, there's been much more appreciation for the rehabilitation component of it. And so there's been much more partnering between orthopedic surgeons and the physical therapist. As far as me personally in the group that I work with, so John Closey is the main surgeon that he's been a mentor for me, and now mentor / collaborator. We're more collaborators currently. He is one of the best like clinicians and investigators that I have ever worked with, and that he's super collaborative, and really his motivation is all about how can we improve care. And I don't care if it's surgery, I don't care if it's rehab, I want to find out what's the best way to treat each person. And it's that real kind of unselfish approach to patient care in an environment where there's a lot of pressure to produce. I just think that's kind of a rare characteristic, and he models that quite well. And he's developed this team that includes all of the groups that you just mentioned: radiologists, physical therapists, engineers, surgeons, non-operative physicians. We've just got the whole gamut there. So I think WashU does a little bit contribute to that, but I think it really does come down to the individual PIs as well. And I've gotten really lucky.
That's great. Well, I think like attract like, and so you're probably one of those collaborative people as well. Now, you had mentioned Dr. John Closey. This is one of my favorite questions to ask a lot of people. Who are your mentors who influenced you the most? And this can be personal or professional, and Dr. Closey being one of them. Maybe sounds like a really, really great individual.
Yeah, absolutely. I know that, so I have a very long list of mentors, and there's not enough time to recognize all of them. So I'll just say thank you to those who will go unnamed, but clearly the first person that I have to acknowledge is Dr. Shirley Sauerman, who really, she's been a mentor on two fronts. From professionally, really pointing out the difference that physical therapists can make, and how to think critically, and how to really treat people individually, kind of a thing. From a personal standpoint, just her approach to life in general, and her passion for many things, including physical therapy, and her ability to kind of set aside any kind of emotions or anything and just get to task. I'm excited about this thing. I want to learn more about it. And I'm going to I don't care who you are, what you do. If you agree with me, you don't agree with me, I want you to come in and let's learn from each other. I just think that's been really, really important. And then from the research, and then Nancy Bloom clinically has been a huge mentor for me in the clinical application of therapy for the hip. And then from a research perspective, Dr. Linda Van Dillen gave me some early appreciation for research and how to approach it. And then Dr. Michael Miller, who interestingly does diabetic foot research, kind of out there, different than the hip, but he really kind of demonstrates the passion for science. Also, the appreciation for others, how to collaborate with other folks, and then also how to have a life kind of outside of work. He kind of helps with balance. And I mentioned John. So those would be there's many others I'm not mentioning, but I don't want to bore your audience.
No, it's not boring at all. And I think some of the common key qualities that these people have is they just put their own agendas aside because they're so curious about just learning, wanting to understand what's going on, and that sort of widens the network. You get introduced to all these new people because you're just purely having the joy of learning.
Mm-hmm. Yeah, so true.
Very good. Well, thank you so much, Marcie. It's fascinating for me to learn a little bit more history of people who I'm interested in. So I appreciate you sharing your stories. Next month, you've graciously agreed to come and teach for the Movement System Monthly community in Japan about the latest in your hip research. So I can't wait to learn what's new and exciting. If you want to give a quick shout out to your Japanese fans, this entire video will be subtitled, so they will see your message before they come to the live lecture.
Oh, fantastic. So Maiko, I just thank you so much for inviting me to participate today and then to do this session, which I'm really excited. My experience in the past when we did the course in Hawaii was fantastic. And the only thing that will be sad is I won't get to be there in person with all the attendees, but hopefully we'll be able to have some good discussion about the hip. So I thank you so much for those who will be attending. I can't wait to see all your faces and boxes. And again, Maiko, thank you so much for all that you do. I think you are continually inspirational in your own way. So thank you so much.
Well, thank you. That means a lot coming from you, Marcie, and we shall see you next month. Thanks so much. Bye-bye, guys.
Thank you.